Good evening to everyone and welcome to today's session. The subject test on Saturday, we can't be able to ignore because a lot of students have joined for subject test alone. So that's the reason they are looking forward for a discussion. So our regular neuroanatomy class, still we need 2 more evenings of your time to complete the neuroanatomy. So that gross anatomy we will spend another 4 days. So by next weekend, by this time, we are confident that we finished our anatomy in completion. After anatomy, we will be starting physiology. So doc, we welcome all our online students, Dr. Mannu, Kavi, Sujata, Akshara, Femida, Jyoti, Jiol Haq, students of Tirupati, Vizag, Dr. Satya, Nayak, etc., etc. So we'll have a brief discussion of the first 100 or 110 questions so that let us warm up on the Saturday subject test also. So let's make the great beginning. I hope a good number of you who are online students might have answered the online subject test which has been posted. So if you did not answer also, you can make a quick guess and participate in the discussion. So let's make a great beginning. Very good. Dr. Fahima is our opening batsman, proposing myelin sheaths are responsible for the white matter appearing as white. Yes, don't believe this answer. Correct answer is A, that is the myelin sheaths which are responsible. You want to draw the cerebrospinal fluid. A needle tip need to pass successively through which of these layers? From which layer to which layer to which layer, and ultimately from there will you take the CSF is a very important question. Question number 2. What is the answer by predominantly most of the people? What is the correct answer? If you want to draw and make a spinal tap, Fahima proposes epidural to dura mater to subdural space to the arachonoid, and then in the subarachnoid space we draw the CSF is what need to be remembered, which is in fact the correct answer. A patient is complaining of a tingling of and pain down the leg involving the little toe. Little toe is which root value? Big toe is what is that big number? You will remember. A very important clue. L5. 5 is big number, no? Big toe is big in size. S1 is the small toe. So 1 is a small number. So that's what you need to remember about the innervation. Very good. Most of you, Sakshi, Kavi, everyone, including partner, Amrita, they also have answered it as S1. What happened? Our Guntur students, find out whether they are still on or not, and also ask Karnul also to punch the answers. Right. The phrenic nerve typically originates at what level, doctor? Phrenic nerve root value. The other day in the neuroanatomy also we discussed, no? C3? C3, right? Very good. Tirupati, Sujata, Amrita, everyone is proposing C3. Yeah, C3 is correct. Don't believe the answer. In the key, there will be few mistakes. So C3 to C5, phrenic nerve. The phrenic nerve typically originates sorry, I think this got repeated. This is the correct frame of the question. The cranial nerve 10 will be extending until where? Please give to Monica and your good name, doctor? Pujita? Right, very good. We are missing Pujita for the past 3-4 classes, maybe due to the rigorous night duties. How many babies have you delivered, Pujita, in the labor posting? Psychiatry? Surgery posting. How many appendicectomies you have done? what you call appendiceal eradication by 2020. Any program is going on? So we are missing our young house surgeons who are sincere and committed to the night duties. Very good. But every day, when we don't see all our students whom we see every day, as a teacher, I have a more motherly heart. So we will be missing you really bad. So where is Dr. Neena? Dr. Neena is not punching the answers today. We are really missing. So tomorrow we have the 9 to 12, the regular full scale grand test. So 12 to 2 we will have a discussion. So Saturday, Sunday we will try to dedicate for totally tests and discussion. Excellent. Question number 5, most of the students have answered splenic flexure. Cranial nerve 10 will be extending. It will be providing parasympathetic innervation to the gut from the pharynx until the splenic flexure of the colon is what you have to remember. Now, very good. Dr. Jiaul Haq is also today available on the floor for a good discussion. That's good. Now, the flexion of the metacarpophalangeal joint and extension of the interphalangeal joint and the adduction of the fingers. It is the function of which important muscle and it is innervated by what? We have already discussed this in the upper limb muscles in our anatomy class. You remember? So what is your answer, doctor? Question number 6. Amrita, Jyoti, Fahima, everyone is blasting. Lumbrical. Oh. Is it lumbrical or something else? I said adduction of the finger also is involved, no? If I only say flexion of the metacarpophalangeal, extension of the interphalangeal joint of the ring finger means you may possibly think lumbricals, L. You remember, no? But I am also saying adduction of the ring finger also. So that is the reason what becomes the answer. Revise your answer, Femida. You like to revise your answer? Fahima revised her answer. Instead of C, she made it D. Palmar interosseous. That's good. Now, doctor, paralysis of the pectoralis minor, origin and insertion of pectoralis minor we discussed, no? You still have that gross anatomy first class. First 2 classes we had few topics in gross anatomy, and from Monday we started neuroanatomy. So maybe you have still the recollection of the upper limb nerves and muscles which we discussed. Question number 7. Amrita versus Dhavangiri, they differ by saying either C versus D. Is it C correct or D correct? What do you say, Monica? You are the judge. You like to say C for cat? That's good. That is the coracoid process is the one. Pectoralis minor will be having an origin. That's the reason any fracture of the coracoid will lead to the pectoralis minor weakness is what you have to basically remember. There is a motorcycle accident and that results in the destruction of the groove of the lower surface of the cuboid. Which muscle tendon will be passing in a very close relationship and which bone is involved? Shoot your answer. Femida, your good name, doctor? Fatima, right? So, yeah. Just like any name, Srinivas Reddy, Raja Reddy, similarly, every name I think ends with Fatima. Good number of names. We also have an online Fatima and we have an offline Fatima available in the center. So Fatima, what is your answer? Offline Fatima. C, you like to say peroneus longus. That's good. I am happy. Guntur also is now jubilantly punching the answers. Next Saturday, I am there in Guntur to conduct an interactive session with our live students. They like to say, are you really alive or you are only a booth who is every day evening coming and delivering a class online. So I said, okay, I will be there in Guntur to say that I am a living human being. So question number 8, very good. It is a peroneus longus. It is the groove in the lower surface of the cuboid bone occupied by the tendon of the peroneus longus muscle is what need to be remembered. And right. Then hypertrophy of the extensor muscles of the leg. It can lead to the ischemia, because which is the important vessel which is in a close relationship with the muscles of the leg? Confident answer? Some confident answer? Question number 9. Yes? You like to say anterior tibial artery? Not sure sir. आप तो lower limb के बारे में कुछ भी पढ़ा है नहीं, हाँ? मगर आप क्या already सीख के आए? So that is important. Question number 9. Amrita, Kavi, Femida, Guntur, Tirupati, everyone is saying anterior tibial. That's right. So anterior tibial, any muscular spasm or a hypertrophy of the extensor muscles of the leg, compress it and can lead to ischemia. Anterior tibial artery is the one which will be giving rise to the dorsalis pedis. Then which fetal vessels becomes the round ligament of the liver after you are born? So in embryology, mainly maternal fetal circulation. And what are the embryological structures and what are the remnants in adulthood? That way anatomy to revise in 2 weeks is a challenge. So at most we may take 3 weeks to complete anatomy in our regular class, because we also need to finish embryology and some basics in histology. So question number 10, what is your answer? Most of the students, Kavita and Sujata, Guntur are all proposing umbilical vein. That's right. So umbilical vein, left umbilical vein typically becomes the round ligament of the liver after the birth is what you need to remember. There is a lesion in the lateral cord of the brachial plexus. So which is the muscle that originates from the lateral cord of the brachial plexus? Brachial plexus, no, we have not yet discussed roots, cords, etc. of the brachial plexus. As such, we did not discuss. So give me your answer otherwise. You like to propose? B, teres? Latissimus dorsi, you like to say? D for doctor, pectoralis major, you want to say? Yes, what is your answer? Pectoralis major, we studied the Naru supply. Major and minor we have studied, na? So question number 11. Even Pahima, Guntur, Davangiri, Tirupati, Vijay Rohit, everyone is pectoralis major. Beautiful. Pectoralis major is innervated by the lateral and medial pectoral nerves, which are originated from the lateral and medial cords of the brachial plexus respectively, is what need to be remembered. If you ligate the brachial artery at its origin, if you go to AIMS entrance or All India, frequently asked question is the vascular anastomosis around the femoral head, around the humerus. This vascular anastomosis you need to have in a complete grip. So what is your answer, doctor? Question number 12. Pahima, Priya, Sujata, no, not Sujata. Priya and Pahima, they are all proposing, they are all attracted by B. Even Amrita is saying B. Is it B? What happened? Brachial artery is ligated at its origin. So posterior humeral circumflex artery, it anastomoses with the ascending branch of the profunda brachii, whereas the lateral thoracic and subscapular do not. So that is the reason it is the one which will be typically able to provide the root whenever there is any obstruction. Now which muscle is damaged? If it is damaged, patient will have dorsiflexion weakness and inversion of the foot weakness. Inverters, everters of the foot, the muscle groups. So initially you keep all these things in reserve, and in the month of October, because if the entrance is in November, October you need to accumulate your energy to revise, no? That time you have a look at these bookmarked areas in the study material. So question number 13, what is your answer, doctor? Most of the people are saying Davangiri, Fahima, Femida, Kavi are all saying tibialis anterior. Beautiful. Tibialis anterior dorsiflexes the foot and inverts the foot. Whereas the peroneus longus and brevis, they invert the foot and plantiflex the foot, opposite to tibialis anterior. Peroneus tertius can dorsiflex like tibialis anterior and invert like peroneus longus and brevis. And extensor digitorum will dorsiflex the foot and extend the toes. You need to have a clear mental picture about all this. Now in a 78-year-old advanced cancer in superior mediastinum, there is a compression. Then which structure is not involved in the superior mediastinum? Otherwise, straight away asking which is not a superior mediastinal structure, basically. What is your guess, doctor? Manasa, no? What is your name? Pujita. Pujita, you are not coming out with answers. Then we'll have a chance to listen more wrong answers. So we'll be little elated in the evening. So please come up with your extempore guess, doctor. You are given a topic and asked to speak. Hemizygous? He is not there with Tulsi, no? He is not there, no? Please remove the key from the hand and guess. Question number 14. Vijay Rohit is proposing D, Girija also, but Tirupati is the lone taker of, you said C? You also said D. Only Tirupati says C. Govinda, Govinda. So, let us look into hemiazygous. Where is it? So, typically, brachiocephalic vein, trachea, left common carotid artery, arch of aorta, they're all the part of the superior mediastinum. Tirupati should remember that hemiazygous is a part of the inferior mediastinum is what you need to basically remember. Now, doctor, severance of which ligaments can damage paraumbilical vein? Otherwise, paraumbilical vein is a part of the which ligament is what I like to ask. Give me one confident answer, doctor. We are all in a complete formalin anatomy mood for this next 2 weeks. I mean, for the next week also. So, give me one confident answer. Paraumbilical vein is a part of which ligament? So, all these various embryonic remnants in the form of ligaments and their constituents, you need to be very sure. So, Davangiri, Amrita, Fahima, Sarvodaya, after a long time I am saying Sarvodaya, everyone is answering it as falciform ligament. Falciform ligament. Falciform on its pre-margin contains the paraumbilical vein, and linorenal will be containing splenic vessels. Linogastric contains left gastroepiploic and short gastric, and gastrophrenic ligament doesn't contain any of the vessels. So this is the typical falciform ligament. When the hand is resting in a supine position, the radius is an articulation at the radiocarpal joint with which of the following bones? You can test it in the exam hall and then answer this question also. What is your answer? Anatomy is a fun. If you know some common basics, then everything else is fun. Just like, I still remember in MD final year in neurology, in one case discussion, suddenly our professor of neurology, he had a very great teacher, Dr. Mohandas, Dr. J.M.K. Murthy, like such stalwarts in neurology teachers. They are all dedicated their lives for neurology. So suddenly he popped up a question, what is central tegmental tract? MD final year general medicine, if you still remember central tegmental tract means you are the guy who really read anatomy in first year MBBS. So we don't remember where is the tract located because in MD final year, after doing so many night duties and submitting thesis ready to pass examination, You are in the end part of your academics. So we were all thinking, where is the central tegmental tract? So the other day when I am teaching you, I recognize that between red nucleus and inferior olivary nucleus in medulla, red nucleus in the midbrain, the connecting tract is central tegmental tract. So that way, anatomy may you must have some general picture of what is structure is there where. So question number 16. Kohima, Davangere, Tirupati, Guntur, everyone say lunate and scaphoid, which is true. Lunate and scaphoid typically along with the radius articular disc will articulate with scaphoid and lunate, and at the radiocarpal joint with the triquetrum. Now, which is important in preventing the forward displacement of the femur on the tibia whenever the weight bearing knee is being flexed. So accordingly we have the anterior drawer test, posterior drawer test in the orthopedics, no? So this is the basis. So what is your ligament? Give me one confident answer, doctor. Posterior cruciate is Tulasi's guess. You also say the same. Question number 17. Even Manu, Priya, Jyoti, Kavi, Fahima, everyone is saying D, posterior cruciate ligament. When the knee is flexed, posterior cruciate prevents the forward displacement of the femur. Then what is the purpose of the medial meniscus, doctor? Typically it forms a very stable base for the articulation of the femoral condyle and acts like a shock absorbing agent. So we have one excellent teacher in orthopedics, Dr. Maheshwar Reddy, who will be delivering the ortho lecture when the ortho time comes. So he is one of the exemplary teacher with a immense clinical experience. Question number 18, lung and bronchi. What is the correct statement regarding the lung and bronchi? Which is a longer one, which is a shorter one, and which is more vulnerable for the aspiration? What is your answer? You like to say D. That is a right main bronchus is question number 18. Even Jyoti, Vijay Rohit, Amrita, Guntur, everyone is accepting that. Right main bronchus is shorter and wider than the left bronchus is what need to be remembered. Which structure in the sigmoid colon? Yeah, give me one confident comment about sigmoid colon, doctor. Which structures are retroperitoneal, which are intraperitoneal structures in the gut? GIT is a very important issue. Okay, question number 19. Sujata is proposing A, but Rohit is proposing D, and Jyoti is proposing A. Who is only proposing D? Priya and Rohit are the only big winners of the correct answer. Typically, the sigmoid colon drains its venous blood into the portal venous system. It has its own mesentery. It receives the parasympathetic innervation from the pelvic splanchnic nerve and receives the blood supply being a hindgut from the inferior mesenteric artery. Midgut is superior mesenteric artery, right? And foregut is celiac, right? So in abdomen we will have a review on, just like brain we had a review on the blood vessels of the brain and circle of Willis. The abdominal vessels and their branches is an important issue for the examiner. The urinary bladder parasympathetic fiber. Some of you are going to become urologists. You are going to prescribe the patients wonderful drugs, and lot of drugs have a effect of causing urinary retention. So you must know what is the innervation of the bladder and mechanism of the continence. Question number 20. Manu, Jyoti, Sarvodaya, Sujata, they are all proposing pelvic splanchnic nerve. Excellent.